Hi, this video is the demonstration of the FUT linear scar, and I try to demonstrate and find as much example of the scar on both FUE and FUT as much as I can. Again, the result of the scar vary from one individual to another. Don't take it as this is for all clients. Some client will have bigger scar, some client have a smaller scar. But again, if you look at my work, it's very consistent. Again, the result vary from one individual to another. Again, this is the demonstration of the strip linear scar running from one ear to another ear, and the scar is permanent. The FUT is a strip linear scar, produced strip linear scar. The FUE produced tiny dots of scar scattered throughout the back of a mosaic pattern, allow you to wear your hair shorter. There's always pro and con for both. The pro of the FUT are it's cheaper than the FUE, and you can harvest more efficient number of grafts, like 5,000 grafts per day. So you can harvest a larger number of grafts per day. So it's very effective for advanced hair loss. So there's always a place for the FUT. So it's cheaper, you can move a large number of grafts per day, and it's good for advanced hair loss. And the growth percent is 5 to 10% better than the FUE. But the downside of the FUT or the strip method, it leave you a permanent linear scar. Number one, you have numbness along the linear scar, not the whole scalp, just a tiny numbness along the linear scar. It's a little bit more invasive, and it's a little bit more painful during recovery. However, on the FUE, the benefit of the FUE, leave you thousands of dots of scar, allow you to shave your head shorter. Again, it's a little bit less invasive than the FUT, and a little bit less painful during recovery. But the downside of the FUE is actually shave your head more aggressive, all the back, number one. Number two, the FUE, the downside of the FUE, it costs more. And number three, the number of grafts we can do is less. We can do 2,500 to 3,000 grafts. Thus, it's more recommended for mild to moderate hair loss. Although advanced hair loss, you can get it done. You just need multiple surgery. And then the other part of the FUE is the downside of FUE is it grows 5 to 10% less than the FUT. Again, both of my work for FUE and FUT, you can't really tell much of a difference. The result can be good. So this is the demonstration of the FUT linear scar, and you can see the line running from one ear to another ear, and it varies from one individual to another. The scar size can change.